We're back. We are back. We upgraded our sound, and now we should be heard a little bit better. It won't drive me crazy when I listen to the playback. So, hey, welcome back to the Longevity Train Now Age Later podcast. A little refresher. My name's Ralph, personal trainer, certified personal trainer through the National Academy of Sports Medicine, as well as a certified nutrition coach. And to my left, probably your right, is Renee.
Renee.
Yeah.
I'm just Renee.
Renee is going to give you the point of view of the client. I will give you a point of view from a personal trainer standpoint. A little bit more about me real quick is that I do have a background in corrective exercise. That's one of my specializations. And I'll be holding this mic this time because we're having a couple of issues with mic stands. But that's okay. It's going to sound so much better. Now today, what are we going to talk about?
Injuries, injury prevention.
Maybe, yeah.
Maybe.
So we're going to talk about injuries after the age of 50, because I think, or
well,
close to it.
maybe after the age of 40.
45-ish.
No.
40. Okay. So into the 40s, into the 50s.
It depends if we're talking about me or you.
Yeah, that's a good point. If we're talking about me, it's going to be around late 40s and then currently. And for Renee, it'll be all the way back to when she was born. Kidding. I will tell you guys, I've got some notes here, and we have quite the lengthy patient history, so that should be fun.
It's my medical
and
chart.
Yeah, basically. But yeah, let's get into it. So I know a lot of people out there are dealing with injuries. Most of the people I think that are listening to this will be a little bit more in our age range.
Mm-hmm.
So I'm 54 years old. Can I say how old you are?
Yeah, 57.
57.
I'll
right?
say it.
Good.
I own it.
Own it.
Own it.
54 and 57. And we both had our share of injuries. For me, I'm dealing with it all the time. So I have a naggy back and my knee acts up every once in a while. And right now I have a real problem with my right Achilles. So it flares up constantly, which keeps me from doing any running, and explosive training is always limited because I will do one day and then have to settle down the next. But you have had quite the extensive list of injuries.
Injuries and surgeries.
What's currently bothering you?
Currently,
Yeah.
the worst of it is medial epicondylitis, or golfer's elbow. I think it's golfer's elbow on the inside.
Yeah.
Tennis elbow on the outside.
And you have both?
No, I just have the golfers, but I don't golf. And I have.
Funny how that works, right?
I know. And bicep tendinosis.
Okay.
And then the cubital tunnel nerve has been irritated, and so it makes these fingers numb.
And do they tingle?
Yeah, I wake up and they're asleep.
Okay.
Yeah.
So we're going to talk about these. We'll get into a little more depth into the injuries themselves. But we're going to talk to you guys about what we've had, how we've gone about keeping our exercise up when dealing with these injuries, if we've even kept it up. I mean, there's times where I can tell you that I probably wasn't very good about it myself, but we'll talk about that. We'll talk about our good doctors, bad doctors, things that worked, things that didn't work, alternative remedies that we may have tried, such as like PRP.
Mm-hmm.
You've had those injections before. Physical therapy, what we think about it, and then we'll touch on our current ailments and what we're doing to work around those, right?
Yeah.
Okay.
Or just live with them.
Or live with them, yeah.
Yeah.
So let's get into your patient file, shall we?
My health history.
Yes, I say it looks like in 2006 was the first thing you've got documented for shoulder pain.
Yeah.
Am I right?
Well, that's the first thing I wrote. I thought was worthy of writing down.
Yeah. So shoulder pain is a big deal, right? Because it affects the shoulder affects us in so many ways in our physical fitness and our daily activities of living. It's a big deal. Any of our joints are, right? But shoulder pain, I mean, you can't. I mean, how do you go grocery shopping, get things off of a high shelf,
exactly,
put things away?
Exactly.
Yeah.
Yeah.
So it said, it caused you restrictive movement.
Yeah. So I couldn't, I could kind of move my shoulder, but it kept getting caught. It felt like it would pop all the time. It would get kind of stuck. I went and I went to a doctor who actually did physical therapy in her office. Then I had 3 cortisone injections in the shoulder. Nothing helped. She sent me for an MRI, said, "Oh, doesn't look like anything's wrong." I didn't like that answer because I knew something was wrong.
Sure.
So I found another doctor And she looked at the MRI, and first she said this MRI is crap
Oh,
because
wow.
it was an open MRI, so it wasn't a very good imaging. But she said there was an impingement, and so I needed to have a subacromial decompression, where they go in, they shave down bone to make room.
They decompress
They
it.
decompress
Yeah,
it.
they make
Yeah,
room in there so it
yeah,
can move around again.
exactly.
Yeah. So if
And
you guys are hearing that, that's basically what it means is they're just going to take it and they're going to probably grind down some bone and that way it opens it back up.
yeah,
Clean it up basically because
yeah,
sometimes we get bone spurs and the bones remodel when we're
right,
injured, which
right,
is funny, right?
yeah,
And they don't remodel the right way all the time.
right. So I had PT after that,
Okay.
and the goal of the PT was just really to first it was, they did stim on it, they did heat and stim and, bring down the inflammation and kind of restore the mobility, and then exercises to increase my range of motion. And that one, I haven't had problems with it since.
That's great.
That this one has been good.
It's been a good shoulder.
This has not been a good shoulder, but we can talk about that later.
Okay.
But
So
the
that's your right
yeah, the
shoulder.
decompression
Worked great.
worked great. Did
Yeah.
everything it needed to do.
I and I think that's probably what happens for most people if there's not something else going on,
Mm-hmm.
which it just gives that room and then you can start working on that mobility again like they
Right.
did with you in PT and then
Right.
probably just doing your strengthening. Did PT work on
Yeah,
specific
we had
strength stuff?
a lot of strengthening moves. They were kind of smaller moves though. They weren't real big, but some of them were, a lot of band work.
Yeah.
Just to
Put some
really
resistance to it, but
yeah,
nothing crazy.
exactly. No, no,
Yeah.
really. And at that point I wasn't, lifting heavy weights or even really lifting weights regularly.
Right. Well, because we're talking about 20 to 21
2006.
years ago.
Yeah, and
Yeah.
this a long time
It's been
ago.
a long time ago.
Yeah.
That was before your real fitness journey. That was
Yeah.
back when you were probably doing mostly just walking if you were
Yep.
doing things,
Exactly.
possibly
That's
some running.
mostly what I did.
Yeah. And then it looks like in 2012 you tore your meniscus in your right knee
Yeah.
and that required
That
surgery.
required surgery because the meniscus was torn and it was flapping around and it kept catching. So I'd be out running or walking and it would just catch and I'd sort of pitch forward and lose my balance. And
Mm,
yeah.
yeah. That's pretty common too, which is that I mean that seems to hit a lot of people. Let's see. So, what besides the surgery, did they offer anything else? Just probably PT after the surgery.
Yeah,
Usual
it
stuff.
was just PT, just
Yeah.
the usual kind of, get range of motion back. It was really stiff for a long time.
Mm-hmm.
And so that was really I mean, I could bend it, but I couldn't straighten it very well. So a lot of the goal was to get me to be able to,
Full
flex.
range,
Yes, full range.
extension, and
A
flexion.
lot of that.
Yeah.
Yeah.
And that's something too that happens, and you see that a lot. Well, at least from what I've noticed, is patients that don't do their PT well, um, especially even after knee replacements, they will not be able to extend the knee all
Mhm.
the way. That
Mhm.
seems to be almost more of a problem than the flexion.
Yeah.
Yeah,
Yeah.
they just can't
It
lock
was
it all
the
the way
yeah,
out.
and I think, well, at least for me when I was on crutches, your knee is bent.
Yeah, yeah,
And
you're holding.
and somebody told me, they go, you better start straightening that knee or you're going to have real trouble. And I'm
Hmm.
thinking, no, I'm not going to have trouble. It's true. I did I did have some trouble getting that knee straightened again.
Yeah. So from a corrective exercise standpoint, by the way, none of this, we're not giving you guys any medical advice. This is just, we're just giving you basically our accounts of what we've been through and how we dealt with them. But definitely see your doctor. Don't listen to what we're telling you as far as that goes. This is for entertainment and educational purposes only. We're not trying to diagnose or treat your problems. That's up to you and your physician or primary care or physical therapist, whoever you happen to see for your health care. But I do want to say this with the extending of the knee, right? One of the best exercises from a corrective exercise standpoint, which I can speak on, is a terminal knee extension with a band. Because what you do is you stand, you put resistance behind the knee, and you extend that knee while pushing your foot into the ground, and you feel that all the way up into your glute muscle, but it activates the back of the knee and that helps kind of strengthen the entire knee so you can straighten it all the way out. You will end up doing that in PT anyway, so I feel confident about telling you about
What's
that one.
funny is I don't remember doing those in
No,
PT, but we do them here.
yeah,
Yeah.
yeah. There's it's kind of funny with PT because there's always, and you can see it online too, so anybody can search whenever you have a surgery on a certain joint in your body, you can actually look up the protocols that they're going to use for physical therapy later, and kind of give yourself a heads up of what to expect. For me, when I see those, I'm able to implement them here, and we'll get into that later. But that TKE, yeah, it's not
Hmm.
always going to be something done. There's so many different exercises you can do
Right.
that they're not
And they
always
have a
going to
very
implement.
limited amount of time to work
Exactly.
with you.
Yeah, really, what are they
So
working with you? Like maybe 30, 40 minutes?
something like
Yeah.
that. Yeah.
And sometimes they don't pay 100%
No,
attention.
they kind of leave you to your own devices. They're like, okay, do these exercises.
Yeah.
And then you're standing there. If you're not well versed in those particular exercises, you're kind of standing around like, what do I do with this
Yeah.
band?
Yeah. What's next? Too,
Yeah,
right? Because
exactly.
they're usually hopping around between different patients. It's
Yeah.
not their fault. It's just the way it works. And they've got to get everybody in and get them out. So we got the torn meniscus, and then in 2020 we had to get surgery. I say we, you had to get surgery to repair.
You had to take care of me?
Not really. He did pretty good. Jeez, I'm horrible. Oh, I helped it with the ice and stuff like that.
Yeah,
Yeah.
yeah.
Um, surgery to repair your elbow tendons because you tore them. Probably that might have been my fault though because of making you do deadlifting, and you probably
No, no,
no wasn't my
no.
fault.
No,
Okay,
no.
good.
So the lateral tendon had given me problems for at least 10 years. And I'd see the doctor and she'd just say, "Oh, you probably have arthritis." She just completely dismissed it.
Kept blowing it off, huh?
Totally. I finally said, "You know what? Give me some PT."
Mm-hmm.
So I went for PT. They did stim, they did ice, they did, whatever protocols they had, a little bit of strengthening. Nothing helped. Well, it turns out it didn't help because it was torn. So I went back and saw the
It's
doctor.
amazing how that works.
Yeah, I went back and I saw the doctor who did my knee and my shoulder surgery.
Mm-hmm.
And she said, "Well, let's try PRP." So we tried the PRP.
What you want to tell everybody what PRP is?
It's plasma rich.
Protocol?
No,
Plasma rich
shoot, I can't
plasma replacement?
I can't
PRP?
remember. I can't remember what it stands for.
I just threw everything off right there,
You
didn't
completely. It's plasma rich
I? Platelets.
platelets.
Yeah.
Platelets.
Plasma rich
Yeah,
platelets.
so they draw your blood in the office, they spin it in the centrifuge,
Mhm.
then they re-inject. Hurts like hell. But she did both sides.
Hurts like hell.
Hurts like hell.
Like a some bitch.
Because they can't numb
Okay,
it.
Sorry.
So they put ice on it to try to numb it, but they
Uh-huh.
can't like put
They can't really numb
they
it.
can't really
Topical
numb it.
numbing
No,
even?
they
No good, huh?
can't do anything.
I wonder why that is. I guess
It
it gets
apparently it
interferes-
impacts the way
interferes.
that it works, and also the
Yeah.
injecting that material back in is very painful.
Mm-hmm.
So
That's what
that's
I've heard from you.
yes.
Yeah.
It's
Actually,
true.
I've heard that too. Yeah.
So, but right after that, the tendon on the other side snapped.
Hmm.
One day I put my hand up to my face and the whole thing just snapped.
Is that right?
It snapped and went down, retracted
felt
down
it?
into my. I felt it. I almost
And did it
screamed.
burn?
What
kind of
it
pain?
felt like a rubber band snapping.
Oh,
It was a very distinct feeling.
okay.
So I went back and I saw her and she said, "Oh yeah, they're both torn. You need to have surgery on both of them."
Mm.
So they did surgery, anchored them. I have these two little anchors holding the tendons in place.
Just pretty cool when you see that on the reenactments or the modeling.
Mhm.
They show you like the what do they call them, animations,
Yeah,
and they show the drilling those anchors into the bone and then
it's
attaching
kind of
them.
weird. Yeah, it's sometimes I swear I can feel them. I don't think I can, but sometimes it feels a little tender, and I think, "Oh, is that the anchor? Is that what
Yeah.
I'm feeling?"
Funny.
Yeah, but I had about 2 months of PT
Okay.
after that, and I still do some of the exercises
Good.
because she warned me about some of the flexion, and she said, "Be really careful because I had to put that tendon back in place, and if you overextend something, it could tear again."
Right. And I think that's another good point to make too, is that just because you've had these repaired surgically, whether it be something that Renee's talking about here or anybody else, once you've had something surgically repaired and you've gone to physical therapy, people, once they get cleared, feel like, oh, I'm cleared, I'm good to go. I don't have to continue to do these exercises. However, I would strongly suggest that you continue that protocol. Keep it into your, you can keep it into your warm up before your workouts,
Mhm.
right?
Yeah, I do a lot of that.
Yeah. I think that's the smartest way. Just incorporate it into your warm up. It may not have to be quite as comprehensive as when you were in PT,
Yeah.
but keep a couple of those core exercises in, not for your core, but core meaning main exercises in to continue to keep those things strong, keep the mobility, keep them from, being injured again.
Yeah.
Injury prevention is the thing people argue over because of the terminology, because technically, you can't really prevent injury all the time, but we want to reduce the risk of getting injured. So that's why it's
Yeah.
so important to keep that
Yeah.
physical
So
therapy.
before I do an upper body workout, whether it's, shoulders or chest and back, I do like shoulder range of motion type things and wrist, flexion and just kind of to warm them up before I start lifting.
Excellent. That's exactly what I would suggest too. Perfect. So then you did a lot of says you did a lot of walking. So things that you did when you
So
couldn't do things with your
yeah,
arms, right? To
yeah,
keep your weight managed,
yeah. I
and
didn't
keep your
do a good
activity.
job at that, but that's a whole other podcast.
Yeah.
But yeah, and so while I was recuperating from that, I mostly walked, and then my Achilles started bothering me,
Mm-hmm.
and because I walked a lot, and
Yeah.
so I kind of got those overuse type injuries, and I saw a doctor about that. She recommended that I go get Graston.
Mm-hmm.
Is that
Yep.
the
Scraping.
scraping,
Yep.
which was really great for reducing scar tissue because apparently both of my ankles were just full of scar tissue from repeated strains and sprains
How about that?
over the years.
Yeah.
And that really helped. Didn't help the Achilles pain, which has been ongoing for 6 years now.
Mm-hmm.
Um, but then at around the same time I was seeing her, I felt a pop, like a snapping rubber band in my right foot, and an MRI showed that I had a partial tear in a tendon in my foot.
Bad luck.
Yeah, bad tendons,
Yeah.
something like that.
Now we won't get into what kind of diet you were eating back then, but it wasn't really a diet rich in amino acids. I'm just going to
No,
put it out like that. And
no,
so we won't go into that though. I don't want to go into that today. We're going to just keep
you
it.
don't want to beat me down.
I don't want to, well, it's not even about beating you down, but I think people need to realize that if your diet is not hitting all the amino acids, your body's made of amino acids, your connective tissues, everything. Uh, that's the building block of protein. You got to have them. And sometimes if you eat a diet that is strictly plant-based, you may be missing out on complete proteins, therefore missing out on all the essential amino acids, therefore allowing your body to break down, theoretically. I'll
Now
throw
I
that out
will
there.
mention though some of my own research
Yes.
has yielded that a lot of middle-aged women
Do.
going through perimenopause, menopause, that those drops in estrogen directly can impact the health of your tendons.
And that's a great point. I think
And
that is a good
but
point to
I
bring
went
up for
to the
sure.
doctor and she said, "What's wrong with you? Tendons don't just snap,"
Yeah, because she wasn't up on
because she's an idiot.
which talk. No, that's not
Okay,
because we
I
can't throw
won't say her
names down.
name.
I want to throw a name down because I think I
It
know who it
wasn't the
is.
orthopedic surgeon, okay?
No,
It was not
I'm
her.
thinking of somebody that works someplace that starts with a B and an F and an
Yeah,
H.
yeah,
Just in
yeah,
the
yeah,
initials
yeah.
of
That
the
you don't
place.
go to anymore.
Yeah, I
Yeah,
don't go there because they suck. But
yeah,
anyway, we won't get into that either.
yeah.
Right on.
So
Okay,
that stuff is ongoing, and I
that's a good
manage it
thing that
with
you brought up too, though. The perimenopause and the drop in estrogen,
yeah.
change in hormonal levels. Those do affect your. For women, it affects their tendons and everything too. And we
Hmm.
do need to make sure that that is not downplayed at
Yeah.
all.
So there's really nothing to do with those things except manage the load.
Yeah.
Um, Before I go for a walk, I wrap both ankles with athletic tape. I wrap the foot. Um, wear compression socks or extra supportive socks that, give me some special cushioning, just or a brace if I need it,
Mm-hmm.
just something so that I can work through that and keep walking.
Good job.
Sometimes I can do, a couple days in a row. Sometimes I have to give it a few days off. Just depends how they're feeling.
Good. But you seem to know how to move on those days that you still want to get something done. You're
Yeah.
able to work around.
Yeah.
And I think that's something that everybody needs to understand too, is that you might be limited in one area, a lower body, upper body, whatever. Then do the opposite.
Yeah.
work on the opposite side.
Yeah.
If
You're
you
just
if you're injured and but you can still walk around and do your walking, go walk,
hmm
do something.
I mean, some days they feel great and I go out and I run and then I come back and the next day I hurt like heck and I don't run again for a while.
Yeah. And that's smart. That's just managing.
It's
That's
all
kind of
about
like
management.
when we talk about, you hear about athletes, right? In fact, lately we're here in the Bay Area, hear about Christian McCaffrey. The guy's been injured a lot. And so this year he's already dealing with a little bit of swelling. I think it was him, right? Or maybe Bosa.
Bosa,
Anyway, a bunch of the guys, they're already feeling it and they're only in training camp.
McCaffrey was in bare feet today and not
Is that
practicing.
right? Yeah. So they're already managing McCaffrey's load. And that's what you do with yourself too. You just manage your load. So hey, you can't do as much volume, crank it down a little bit. Give yourself a chance to recoup and, get back out
But it
there.
doesn't mean
Stop
eliminate it.
everything. Yeah.
Don't just sit around and do nothing
No.
because that's going to help you gain weight and put more
Yeah.
pressure on yourself.
Yeah, it leads to a lot of things when you're not active, right? You can get into a little bit of a mental funk. You're going to eat worse maybe because you're just not feeling good, not feeling happy about yourself. You're depressed. If you're an active person, you're going to be a little bit depressed because you're not able to be as active.
Mhm.
But
Yeah.
that's where it's key too. If you really can't do anything, you've got to keep the nutrition on point.
Oh
Keep
yeah.
those calories in check.
Yeah.
Prioritize protein, fruits, vegetables, lean proteins. My usual spiel.
Yeah.
Okay, so it looks like you've had a few other things, but let's just talk about the frozen shoulder.
The frozen shoulder, my left shoulder.
Yeah, and you know what? I think you could get back into the perimenopause and the associations with
Right.
frozen shoulder and
Right.
menopausal type
Right.
issues too.
So drops in estrogen have a direct correlation, at least from what I understand, with frozen shoulder.
Yeah, from what I've
And
read too.
so, and I thought I had another impingement because I could, it was starting to get really stiff. I couldn't move it very well. I went back to my orthopedic surgeon and I said, I think I have an impingement. And she said, how old are you? And she goes, I know what this is. I said, what? She goes, it's frozen shoulder. I was like, no, that means I'm old. It can't be frozen shoulder.
Yeah.
And she gave me an injection, but I had waited too long to go see her
Oh,
and it froze anyway. I was already well into the first stage, the freezing stage.
okay.
So it froze and it didn't unfreeze for like 2 years.
I remember it was a
So,
long
yeah,
process.
but you put together a pretty decent protocol for me um, to try to keep as much mobility as I could, um, get my range of motion. I mean, we couldn't get it back because the whole thing was frozen. I mean, you couldn't even move it, above
Yeah,
that level.
I think you were
It
stuck
was,
below
yeah,
parallel to the ground even.
yeah.
Yeah.
But you did help with manipulation to try to kind of move it around, and um, that was kind of a wait and see, and just wait for it to unfreeze kind of thing. There wasn't a whole lot I could do about it. I just worked on just, I worked around it is what I did. I still worked out, but I did a lot of single arm stuff instead of both at one time. I'd use handles instead of a bar or, a single attachment.
Sure.
I do one arm and
Unilateral work.
do what I could with this one and do
Hmm.
whatever I could with this one.
Right. And I think it didn't really affect you. I mean, long term, obviously, it slowed you down a little bit.
Yeah.
But once it got healthy again, I think that your strength picked up and kind of equalized between the
It
two
did.
limbs.
Yeah,
So
I
it
was kind of
wasn't,
surprised because I was worried if I was working my right side heavier and, I could only lift like 5 pounds on this side, was there going to be some sort of imbalance? And you told me just do it. It's not going to be a problem.
right.
And of course you
Yeah.
were right.
Oh, of course. I
Of
was.
course you were right.
Trust me, I'm not really right very often, but there's been research into that your limbs seem to recognize what the other ones are doing and the size of them, and they kind of keep up with each other. It's a strange
Yeah.
thing,
So there
right?
was very little disparity once it finally unfroze.
Yeah.
Yeah.
Yeah, that's what I noticed too. I thought that was pretty cool.
And then one day it was just
Pretty much
moving
better.
again.
Yep.
And then right after that, I sprained the AC joint in it. And that was a couple of months of having to walk again a lot because I couldn't do anything with it.
It really feels like it's one thing after the other. But here we are. We're doing good
Who knew I was
mostly.
made out of paper mache?
Yeah. So and right now, I know you got some aches and pains that you've been working around as well.
Yeah, the elbow is just it's
And that's your left arm again.
left arm, yeah, the epicondylitis on the
Mm-hmm.
medial side. I've had one injection. It lasted 4 months, felt great, and now I'm just putting it off because I can only have three in a lifetime
Right.
in that joint or in that tendon.
Yeah,
And
that's the one thing is that those are not cures. They will not heal you, but they will take away the inflammation. And that's it's a good thing and a bad thing. I mean, it takes away the inflammation and then you start working it, then it may come back. It's a band-aid.
I will admit I'm not very good about laying off. So
No.
ideally, I probably should have gotten the injection, not just taken 2 weeks off, probably rested it for
A month
a
maybe,
month,
yeah.
not went, oh, I feel so good. I'm going to go right back and do everything I
And
was doing.
honestly, you should have probably the way you came avoiding a lot of different movements, you should have probably gone to what I'll talk about here now is with injuries, maybe get into some isometric holds first.
Yeah.
Things that strengthen the connective tissues, but don't stress them out and don't stress the joint
Yeah.
overly anyway. So that's what I'm finding. And honestly, when you go through physical therapy for a lot of things, like a knee, I've had 2 surgeries on my left knee. One of them was more severe. The first surgery was a torn, went in, meniscus was torn, but then they also found that the femur had worn out on the end, had potholes worn into it, and was actively bleeding blood and marrow from the bone, right?
Disgusting.
Gross. You
So
were getting
gross.
hungry, though, thinking about it. You were like,
Oh, I don't eat meat.
reminds
Nope,
you of
that's
your
disgusting.
reminds you of your old days. So had to keep her out of the OR so that I made it out alive. No, but so then they had to do microfracture, punch holes, clean out they debrided.
Right?
I don't know. Anyway, they cleaned off the bone, cleaned it all up, right? Smoothed it out. Then punch new holes. This is the microfracture procedure. They punch little holes in the end that causes new blood and marrow to make a new soft tissue on the outside of the femur or the end of the femur. They call it chondroplasty because that's your little, what are those, epicondyles or whatever at the end of the femur bone, the little trunk part, right? Same,
Epicondylus, yeah.
joints, right?
Yep.
So they do a chondroplasty, fix it back up. But when you get done with that, you cannot put any weight on that affected leg for 6 to 8 weeks. So that means they didn't want me to even touch the foot to the ground. So I had to get good at single leg strength with my right leg because you can imagine trying to sit down on your toilet when you only have one leg. Now I'm doing pistol squats. Who knew I could do a pistol squat?
Get into the shower.
Right,
That
get in the
was a
shower, one
challenge.
leg. Everything's so tricky. Luckily, I was in halfway decent condition by this point because I knew I needed to get back into some shape before I went in for this surgery. So I did. But PT was very extensive. I actually learned a lot from that. That kind of got my brain back on the track of maybe doing some personal training at that point. So that was one. The second meniscus was pretty much a piece of cake. They just went in and cleaned my meniscus up. It was the same leg though. So they keep threatening me with a knee replacement. I've been pretty good holding it off with a lot of exercises. But one of the things I want to get back to is the isometric holds, because you will start to lose activation of your quadriceps when you have a knee surgery. I think anyone who's had one can tell you they start to atrophy in that quad.
Mm-hmm.
You had the same, because you've had a knee surgery too. Yeah. For your meniscus. And the same thing, your quad will start to disappear. You'll start to lose the we'll call it the definition between each muscle of the quadricep.
Not sure if I ever had that to begin with,
It was
so I
under
may
there.
not have noticed.
It was in there. But you'll start to lose that. And so they start with isometric holds, just holding that leg out into a position and kind of flexing it and holding it in static position like that. That is a great way to do it. And it's really good for your legs like that to activate them, along with some electric stim. But a static hold like that is also good for the low back. Oh, excuse me about that. But what I'm finding is I didn't like to do bent over rows when my L4, L5, and SI joints were bugging up. And then lately I've been putting in the bent over
Mm-hmm.
barbell row and just holding that position bent over with holding a load in my hands. That
Okay.
sounds gross. I
That
don't
does
know why I
sound
said that.
gross.
Holding weights,
Wasn't
resistance in
really
my
the right
hands.
way to say that.
Yeah, there's no good way. So I'm in that position under strain, and that hold makes all the little muscles in your back. I don't go into all the little ones because I'll mess it up, but there's a lot of tiny little muscles that surround your spine. They get activated, and boom, it really seems to strengthen everything up. So, my big recommendation would be throw in isometrics first, maybe resistance bands next when you want to flex and extend.
Mm-hmm.
Very light resistance, and just build up into that. And then again, throw them into, once you get all better and everything, and you're back up and running, then keep those in as part of the warm up to lead you into the big stuff. Did I talk too long on that one?
No,
Okay,
no,
good.
no, that's good. And that's stuff I probably should have done because maybe my elbow wouldn't hurt so damn much right now.
Yeah. No, I think we learn, that's a problem, right? You learn as you go along. And
And I'll admit I'm stubborn. Um, I like seeing gains, and when I think about having to regress,
mm-hmm.
I don't want to do it because I'm like, I know what I'm capable of.
Yeah.
Don't tell me I can only do a band, a
Uh,
5 pound resistance band. Don't tell me that.
yeah. It's really
Yeah,
hard when you've been
it's
at a certain
ego.
level. It's ego.
It's 100% ego.
It's like, you know, foam rolling. We know, yeah, it works, man. Self myofascial techniques, they work, but they're kind of boring. Who wants to lay on the ground and start rolling yourself?
Roll,
And they kind
yeah,
of hurt a little bit too
yeah,
if you
they
have
do.
issues.
Yeah.
But they are well worth it to throw in and get used to doing that as part of your warm up before anything or on a recovery day. So you've had some good doctors and some bad doctors.
Yeah,
Yeah,
yeah.
like you
Um,
said, the one doctor didn't even recognize that there was a problem.
no, no. And I feel very strongly that you have to advocate for yourself.
Yes,
And
definitely.
hopefully you're able to do that in whatever healthcare, plan you have that you can. I mean, we're lucky and we can go outside the general practitioner and be like, you know what, I can call my orthopedic surgeon and just make an appointment,
Yes.
you know. Um, some doctors they insist on you getting a referral anyway,
Mm-hmm.
but I've gone to doctors who have just completely dismissed in fact, I mean, I went to the one who did my carpal tunnel surgery before any of the other stuff happened. I went and saw him about my elbow and my knee, same ones, and those were they said, "Oh, we'll just give you an injection, you'll be fine." Or use a counterbalance what's that
Brace.
called? Brace,
Mm-hmm.
and that'll take care of it.
Yeah.
Never did,
No,
but they're the doctor. What do I know?
that's the thing too, right?
Yeah.
They're supposed to be the experts. We rely on them to do the right thing and to be educated on the up to date research and techniques that are out there. And they're human beings.
And
They're human beings just like we are. And I'll tell you, we don't know everything. And there's a lot of stuff out there to learn. And that's why they call it a practice.
well, and honestly, that doctor, you would have to wait 3 hours
I
for your
remember.
appointment.
Yes.
I think I just wanted to be done with that doctor too.
Yeah.
I think I was willing to accept his his responses and
He,
just call it good.
yeah, he
Kind of live
was.
with it.
I had a injection as well from him for the knee bursitis back then, and it fixed. I mean, it made my bursitis go away, and actually, I was fine for. Actually, I never had another problem with the bursitis,
Mhm.
but it did take 3 hours to get in to see this guy, and it was
Mhm.
ridiculous. It was like your time was not worth anything, but his time apparently was. I hate that about doctors. I hate waiting. And as I
Yeah.
get older, I don't have any patience for it. I will rip into them about keeping me waiting because I'm like, hey, Why should I pay you? You would have charged me if I was late. You're late. Why don't I charge you?
Ooh,
Yeah.
someone's getting fired
See,
up.
don't get me fired up. Don't get me fired up. Huh?
That's a sore subject.
Yeah, I'll get pissed off about that. Um, okay, so we've had some successful treatments. The PRP wasn't really successful for you, right?
No, but I think that it might have been had the tendon not been torn. I think it
Okay.
if it had been earlier in the, if I'd gone to see her before it got to the point where it did, um, but I'm just kind of a suck it up and live with it type of person.
Mm-hmm.
Don't make waves, just kind of try to get by as long as you can until you can't. And if I
Yeah.
had persisted a little more, probably might have helped.
Yeah. Once it's torn, you pretty much need surgery at that point.
Yeah.
There's nothing that's gonna, we're not even gonna talk about peptides and stuff, but there's nothing that's gonna fix a completely torn tendon or ligament. It's not going to
No.
fix it. There isn't a drug out there for that yet. I'll say yet just in case.
There could be someday.
Maybe there will be. Um, yeah, I haven't had any other, for me on my stuff, I haven't had any alternative remedies. In fact, they really didn't treat my back at all, which was upsetting. I had an
You had
MRI.
acupuncture.
I did have acupuncture.
Mhm.
Okay, you're right.
I've had acupuncture.
Okay, you're right about that. And the acupuncture, like the very first visit I had, the acupuncture felt good.
Mhm.
It actually worked and relieved a lot of pain.
I had it for a pinched nerve in my shoulder,
Mm-hmm.
and it worked wonders. It was so good at relieving that tension and that stress, because that's where I hold a lot of my stresses in my traps, in my shoulders, in my
Yeah.
neck, and the acupuncture was great. I was so nervous about it, though. I was so scared.
Because
I'm afraid of needles.
yeah.
I mean, they freak me out. And I was thinking I'm going to be full of needles. And for some reason, I was thinking I was going to like move around and all the needles were going to go buried into my skin or something like that.
But you really just lay there calm.
You just lay there calm.
Yeah.
Yeah.
Now, since we're talking about acupuncture, a lot of people might be interested in that. Was it tell us about the setting of the room.
Setting the room, it's quiet, it's kind of dark and relaxed and
Little music
soft
sometimes.
music.
Yeah.
You know, she gave me, well, she offered an eye pillow. I'm kind of stubborn about it, and I was like, no, I don't want an eye pillow. I want to be able to see what was going on,
In case somebody else came into the room.
just in case.
You're afraid. You're like, ooh, what is going on
But
here?
it's very relaxing. You know, it's warm. You're not cold or anything. It's not a cold, sterile,
Right.
table or something. It's just a very nice, relaxing environment.
Yeah. For me, same thing. Acupuncturist comes in, tells you what he's going to do. Mine was a male. And luckily, the first time, because of my back pain, I couldn't lay down on my stomach. So I laid on my side, and he put the needles in wherever they were supposed to go. Had music going, walked out the room, killed the lights. I laid there for 20, 30 minutes, whatever it happened to be. And it did. I felt relief. It felt so good. I walked out of there feeling very good. Now, then I thought I was better to a certain extent, and then I was laying on my stomach for the next treatment, and then my back hurt and I couldn't get up off the table very well. It took me a while to warm up to that. So I went through them while I was lay there. It felt great. When I'd go to get up, not so good anymore. So I was a little bit I should have insisted on staying on my side, and I did not. So my bad on that one. But
Did you feel tired afterwards?
I felt very relaxed.
Yeah.
Yes.
My treatments were usually in the evening after work,
Mm-hmm.
and they made me so sleepy. Driving home, it was dark already, and I was like, how am I going to get home? I'm just kind of in this like warm cocoon right now.
Yeah, that's
It's
interesting too.
it was very relaxing, and the stress melts away.
Yeah.
Yeah.
It's funny when they hit like a certain spot and you just feel
Oh,
it
you
just
feel
release,
it. Yes.
and you're like,
It's
ooh.
amazing
Yeah.
when
Because
they
some
hit
people
that
say
spot.
that they've had acupuncture and that doesn't really do anything for
No,
them.
I've had that before. In fact, when they put a needle right there, it was like,
Between the eyes.
it was crazy.
Yeah.
It was a crazy feeling.
Chiropractor. Have you been to one?
I have not. Well, the actually, I've seen a chiropractor, but it was for the Graston.
Okay.
Yeah, but she didn't do chiropractic on me.
All right. Yeah, the chiropractor. I also tried that for the back problems. Let me tell you, he is a good chiropractor. Felt great when he would release my neck, but and I was actually afraid of that. I was like, oh, please don't break my neck. And he didn't, obviously. That's why I'm here. But the back, he would try to crack that back, man, and it hurt so bad. My lumbar spine and my mid back so stiff, couldn't crack it. But he would jump. He was a little guy, and I was still over. I was like 210, 15 pounds probably. And so he was jumping basically on top of me. It probably looked hilarious, trying to put all his weight into cracking my back, and all it did was just hurt worse. So I stopped seeing the chiropractor after about, I don't know, I had quite a few visits, probably like
You
12
did,
or
yeah,
something like that.
yeah.
And then it was like, okay, this isn't working. And the last time I saw him, it hurt so bad that I was like, I'm done. I can't do it anymore. I'm not leaving feeling good. I'm leaving feeling worse.
You weren't getting enough of a benefit out of it.
No. And then of course, this was all I was seeing these doctors and they were giving me the runaround and I wouldn't give me injections, wanted to try other stuff, everything they just kept shooting down. So my experience with it wasn't so good. And now I still deal with the pain. And what I do is I just try to do my best, keep strong, keep my weight down, and work on my flexibility, which I'm awful about. So that's on me. I need to be better about that. And recovery days,
Yeah.
which is today.
Today,
Today, I'm not
that's
going to
right.
do anything except for,
You're not.
yeah,
I wasn't sure.
I
Kind of
decided,
thought you might do
no, after
something.
training this morning with a client, I said, you know what? I'm going to take the day off. I need to
Good for
because
you.
he and I did some stretching and I said, man, I need to do a little more of that today and a less of,
I was kind of looking forward to recovery today for myself
yeah,
because
because you're feeling beat
I
up.
I feel beat up. Yesterday was I did a lot yesterday.
Yeah.
It was yeah, it was a lot. Need a day to recover before tomorrow.
Let's talk real quick because we're running, I don't want to run too long on this this welcome back podcast.
Welcome back, Paul.
Yeah, but it probably isn't even filming anymore. Something probably happened to it while we're talking. That'll suck. I'll be so pissed. But hopefully it is. Let's talk real quick about physical therapy and what were your thoughts on it? Did you find that physical therapy was useful or not?
I think physical therapy is useful. Um, However, I'm not crazy about the way that it's managed.
Say
That there's so
say
little
more.
attention on each client. You know, they kind of give you instruction and then run off to take care of somebody else.
Mm-hmm.
Now, I'm somebody okay, so you'll see people in there and they take like 20 minutes to do one set of something.
Right.
I'm like, okay, I'm done with my 3 sets in 5 minutes. Where'd you go?
Mm-hmm.
You know, hello, excuse me.
Yeah.
What do you want me to do now? So it's not, I'm not saying that I'm, advanced or anything, but it, working with, 80-year-olds is different than working with 50-year-olds,
Yes, that's
right?
true.
Am
No,
I
you're
wrong?
it's
Um,
probably the very rare 80-year-old that is going to keep up.
yeah. And so it
But
just
they're out
doesn't,
there.
yeah, it just kind of, I don't know. I just find it annoying, I think.
Okay.
It's probably just me.
But the physical therapy itself is worthwhile.
It is worthwhile.
Okay. I
Yeah.
think I know what you're talking about too, because so I run into this when I'm training clients. If I have more than, let's say, two, well, I really like to train one on one because then I can give that person all the attention they need. I kind of think about it like the, was it the Jerry Maguire, you know? I want that one client
Right.
and I want to take good care of that client for that time I'm working with them. I don't want to have to divide my attention because then my attention is divided and I'm not
And
giving
that's
you.
what happens at physical therapy clinics.
Yep. Because they're
They've
dealing with
got
maybe
3 or
five.
4, maybe 5,
Yeah.
all doing different things at the same time, and so there's a lot of standing around kind of waiting. I feel like they could work you through something in a shorter amount of time. You wouldn't have to be there for an hour if if you got their undivided attention. Run through the things
Yeah.
and
I think for
get you out the
them,
door.
the problem is that one, it's obviously it's financial, right?
Yeah.
So they're at a business that depends on pushing more people through the doors.
Right.
And then of course insurance, and then the number of people that go to physical therapy either prior to or post surgery
Right.
surgeries um is crazy because all day every day surgeons are busy operating on
Right.
people, and
And
then they have to.
sometimes it takes weeks or even more than a month to get in. Well, that's how it was on your last knee
Yes.
surgery.
So my last time when my meniscus was torn, just a torn meniscus, they weren't going to be able to get me into physical therapy for like 2 or 3 months
Yeah.
post surgery. So what I did is I just ran myself through the protocol, and then unfortunately I already knew these physical therapists from being in there before. So I just contacted them when they finally had an appointment. I went in, talked to their head guy actually, and said, "Hey, I won't say his name, but uh, can you just run me through the final protocol test and see how we are? Because I've done everything myself." He did. He did a quick little review,
Assessment.
yeah, assessment of everything, and he said, "Man, I can't help you. You've already done it all, so you're good to go." He goes,
Right.
"There's no restrictions for you."
Yeah.
Signed me off, and I
You
was out the
PT'd
door. I
yourself.
PT'd myself, which was kind of nice just because I had the knowledge to do it and the ability, but not everybody has that or has the resources when it comes to equipment and stuff to do like we do here at Longevity. So I was lucky that way, but I do find that the physical therapy is a really good resource for people before they go and have surgery. Like
That
I think it's
Yeah,
important.
actually that would be a good protocol for doctors to have people go before
Yeah.
to kind of set them up
And
for
most doctors,
success.
like a good doctor, will not just go, let's go ahead and cut on you right now. They will say, have we tried physical therapy yet? And most people go, oh, come on, I just
I
need
don't want to do
surgery.
that work. Yeah.
Yeah, just
Yeah.
give me the surgery already.
Yeah.
It's like, well, you're gonna, you surgery is kind of a bitch, man. And there's risks that come with surgery,
Yeah.
and then you still got to do physical therapy after. So
Yeah.
why not see if maybe you can avoid the surgery altogether? Plus, I don't know, is it free to have surgery? I pay something every time
Yeah.
for surgery. It's not
Yeah.
cheap.
I mean, PT's a drag.
Downtime.
Let's be honest. PT's a drag,
PT sucks, but
but it is helpful. It really is.
it is, and you can learn a lot that you can carry on with you later on.
Yeah,
I think.
you can still do those exercises.
I mean, I throw in those exercises sometimes when people tell me, "Hey, Ralph, my shoulder's bugging me," or they have a postural defect. Well, what do you think we're going to do? We're going to throw in corrective exercises. If I see a scapula winging where your scapula sticks out a little bit too much, or I see you hunching one shoulder up and not the other one, they're not equal. I see your hips out of alignment, whatever. Those are all going to end up being PT type exercises that we're going to throw into. We call them corrective exercises, but it's the same thing, really. And
Hmm.
so we start adding those in, building you back up, getting those muscular imbalances out, and voila, you may not have that same pain or issue
Hmm.
anymore, and then you can avoid the surgery if you're willing to work on it, though. That's the other thing
Hopefully.
too,
Yeah, you
right?
do. It does. Yeah, it does take effort.
Yeah,
You got to be willing
consistency
to, yeah, you got to be willing to put in the work for it.
for sure. Yeah, and that's something I feel like I think you and I are usually pretty good about that. Like if
Hmm.
we get a protocol, it's like, hey, you should be doing this minimum 3 days a week. Then you know what? We're so crazy. We go, you know what? 3 days a week. Well, then I'm gonna do it five
Five
days a
days a
week.
week.
I'll show you.
Yeah,
Yeah, that's how it is,
that's a
right?
little, yeah.
I mean, I
That's
went nuts
probably a
after
little
the
much, but
last meniscus surgery. I was like, oh, I'll get back
yeah,
fast.
yeah.
Because I don't like downtime anymore. I like to keep up on my fitness, but not everybody can have that time to do that, and that's okay. Take your time, be consistent, and you'll be okay as well. So yeah, so that's how we think about physical therapy.
Yeah.
Yeah, I think it's a worthwhile. Um, but yeah, the attention, you just don't get that attention you need, and it happens. Group fitness is the same way. You go in for group fitness, the trainer's running around checking on, let's say 5 people. They're not always going to be at the same level of fitness or ability, coordination, whatever it happens to be, and it's going to mean that the person that's really advanced will probably be left out to do whatever they're doing.
Right.
They're just there, and I feel bad about that because they're paying the same way, and I don't know, for me, I just want to give them that attention as well, but instead you'll have to spend more time with the person that's at the new end, the beginner, the novice,
Right.
you got to spend that time with them to make sure that they don't hurt themselves. They're doing everything correctly.
Right.
Okay. But if it's all about time crunch and stuff like that, and
In a
people are
perfect
cool with it,
world,
then
it's all one-on-one, but
yeah.
it's not a perfect world. So,
And some people need to maximize that dollar, right? It is a business. You know, for me, luckily, it's not my main business. Oh, it is my main
it is your
business.
main
What am I
business. It's
saying?
your
It is my
occupation.
main business. It's my occupation, but it's not my main source of income, I should say. So, yeah, thanks for correcting me.
You're welcome.
Man, you were ready to snap me out. All right. What else? Should we talk about anything else?
I don't know. We've been
So
talking a while.
yeah.
I don't know how it always feels like there isn't going to be enough to fill the
We could
time,
talk. Yeah.
and then we just start talking.
And this is just
We
one
probably
topic.
don't make any sense, but
Yeah. Guys, hopefully we are making sense. Hopefully these microphones sound better for you and the sound comes out better. I don't know what was going on before. We're going to try to make sure things look better, sound better, and come up with some interesting topics. But yeah, we can talk about different things. I can talk a lot.
you are a talker.
When I was born, I actually came out of the womb and had a conversation with the doctor about how he did on the procedure.
I bet you did.
I did.
Yeah,
I was like,
that
yo,
sounds about right.
those forceps, little tight, doc. Look at the shape you put on my head now. Just look how deformed I am.
Oh,
terrible.
man, that's why you wear a hat, huh?
That's why I wear a hat, because I have a cone head. No. That's why I wear a shirt now, too, because after my appendectomy, the doctor sewed my belly button shut, basically, make it look like I had a stroke.
You have a belly button.
My belly button
Would
looks
you
like I
quit
had a stroke.
whining about your
Stroke
belly
at the belly button only, though. It's like this.
It's because you're so lean. You have no body fat.
Whatever.
It's true.
All right, so that's it. Remember, guys, train now, age later. We'll come back with something new. Like and subscribe to these podcasts if you like and want to subscribe, right?
Yeah.
All right.
Up to you.
Till
Free
next
country.
time. So far, it is
So
a free
far.
country so far. All right, that's it. Till next time. Train now, age later.